Hi, my name is Gandhi. I'm a pediatric surgeon. I've been teaching mindfulness for the last 1 year. I've been teaching different professionals in a hospital setting. I recently took a course with Dr. Mang and learned how to teach developing emotional competence using mindfulness. I grew up in Burma, where I was exposed to mindfulness teaching in Buddhist temples in Burma. And in the last few years, I spent multiple silent retreats and Buddhist centers and deepened my practice of silent meditation and took courses with University of Massachusetts to learn mindfulness and application of mindfulness and mindfulness-based stress reduction. I took the training of mindfulness from Dr. Kabat-Zinn and Dr. Saki Santorelli at University of Massachusetts Center for Mindfulness. Mindfulness is the awareness which we bring in to focus our attention on purpose at the present moment and non-judgmentally. We are always lost in the thoughts of the past or planning for future. We happen not to live fully our lives at the present moment. Mindfulness teaches us how to live the life fully, realizing what we have and what we are planning to do in future, rather than being lost always in the past or future. Mindfulness teaches us how to handle our thoughts, emotions, body sensations, and our behavior. By able to listen to our body, we realize that the sensation in the bodies can tell us about our thoughts and emotions much before we can think about these. Using the mindfulness-based stress reduction, Dr. Kabat-Zinn has been treating patients with chronic pain, anxiety, depression, and people with high blood pressure, heart disease, psoriasis, and many other diseases related to autoimmune diseases successfully. Mindfulness let us handle the stress much better and help us to develop stress resilience. Practice of mindfulness involve formal practice and informal practices. Formal practices involve practicing mindfulness meditation. This practice of mindfulness meditation involves focusing on our breath. When we sit down comfortably with our feet touching the ground and we feeling the seat while we're sitting down, keeping the back erect and head straight with the eyes slightly looking in front or close, we focus on the breath. When we are focusing on the breath, we are feeling the in-breath and we feeling the out-breath. We try to follow the full breath at one time. While we're focusing on the breath, our mind might wander and think about the past or the future, or we might have emotions like sadness, anger. When these things appear while we are practicing, we immediately tell ourselves that this is the time that we want to focus on the breath. If this happens multiple times, we come back to our breath multiple times. With practice, we'll be able to sit in meditation for much longer. We could start as small as one breath at a time, but as long as sitting few minutes, few hours, until we feel that we have a mindfulness practice. I've been doing surgery for many years, and recently I'm doing less surgery, close to my retirement. I realized that after studying mindfulness, when I teach others, it not only could help others, it's also helped me to live a much fuller life and to be more present in what I do. I have been teaching mindfulness stress reduction, but then I realized that many people do not want to admit that they have stress in life. Google course teaches us that you can teach mindfulness and you can help people to have better emotional competence. Many people feel that emotional competence is one of the qualities which help you succeed in your life.